Physical activity is defined as any movement that uses skeletal muscles and requires more energy than resting. Physical activity can be divided into three types. Number one, total physical activity, which is all types of physical activity, including recreational, occupational, and transport. Number two, recreational, which encompasses planned exercise, sports, and other forms of physical training. And number three, occupational, which is any physical activity at work. This can vary from sedentary to light, moderate, or even vigorous physical activity. The important concept is that all movement counts as physical activity. Movement can be incorporated into everyday living, shopping for groceries, mowing the lawn, gardening, walking, or biking to work, cooking, parking far away from the front door of a store, taking the stairs and not the elevator. The possibilities are endless. The bottom line, get up and move every 30 minutes if you have to sit at a desk. The benefits of regular exercise and overall increased movement include substantial protection against heart attacks, stroke, high blood pressure, diabetes, obesity, osteoporosis, depression, dementia, aging, and yes, cancer. Let's focus on cancer. Physical activity has an effect on many body systems, including endocrinologic, immunologic, and metabolic processes, which in turn can affect the risk for the development of several types of cancers. Being physically active also helps maintain a healthy weight, which can protect against cancer. Physical activity and cancer prevention have multiple mechanisms, including enhancement of the immune system, improving insulin sensitivity, lowering insulin-derived growth factor 1, and generally improving metabolic profile, which has a strong influence on cancer development. In the third expert report on diet, nutrition, physical activity, and cancer, the World Cancer Research Fund reports that physical activity convincingly decreases the risk of colorectal cancer. They also report that physical activity probably decreases the risk of postmenopausal breast cancer and endometrial cancer. Limited evidence suggests that physical activity can decrease the risk of developing esophageal, lung, liver, and premenopausal breast cancer. In addition to having a role in primary prevention of cancer, there is increasing evidence for the potential for physical activity to influence cancer-related outcomes and survival. Multiple studies in breast cancer survivors have shown that regular physical activity is associated with decreased risk of breast cancer-specific death and all-cause death. Similarly, promising evidence is also seen with colorectal and prostate cancer. What is the bottom line? Be as physically active as possible, incorporating as much movement as possible into daily life, and limit sedentary time. This can be done as daily exercise, meaning 30 to 60 minutes of moderate activity, a minimum of 5 days per week. It can be incorporated as part of work, chores, walking or biking to work, playing outside with the kids, taking the stairs. Again, the possibilities for incorporating movement into daily life are endless. For all the romantics listening, dance. Dance is one of the best activities there is because it incorporates aerobic exercise, complex muscle movement, and memorization into one activity.